Hello, I'm Karen Christiansen, president of ACT's Retirement Life Communities. Welcome to another episode of ACT's Vision, Our Journey Forward, filmed on September 23rd, 2021. As we officially welcome fall and the changing of a new season, there continues to be significant developments regarding our nation's ongoing battle with the COVID-19 pandemic. You have undoubtedly been following the news reports of COVID-19 positivity rates climbing and related hospitalizations increasing. As we all know, these numbers are being driven primarily by the highly contagious and transmissible Delta variant, which now accounts for 98% of new COVID cases in the country. Not surprisingly, positivity rates seem to be highest in those areas where vaccination rates are lowest. While we are not seeing new mask mandates at this time, many prominent health experts continue to strongly recommend the wearing of masks indoors for both vaccinated and unvaccinated individuals. With the rise in cases and high transmission rates across the country, we continue to urge all residents and employees to be extremely cautious, especially when traveling off campus, as the evidence is clear that COVID-19 is still very active throughout the country and in our local areas. At this time, all ACT's communities are in areas that continue to experience high COVID transmission rates as classified by the CDC. Given the continued presence of the virus in and around us, and the number of asymptomatic cases, we continue to test our employees on a routine basis, and we immediately test residents and staff who develop symptoms that would dictate testing. Unfortunately, we have begun to see instances of vaccinated residents and staff test positive. In each case, we have conducted secondary testing to determine the accuracy of the preliminary positive test result. Currently, there are 58 active cases across our family of communities. This is a decrease of 19 cases since our last episode. The number of cases is almost evenly split between residents and employees, are specific to exposures outside of ACTS, and do include some breakthrough cases. Fortunately, those that are vaccinated and test positive typically have mild or no symptoms, supporting the effectiveness of the vaccines. Here at ACTS, more than 9,200 residents and nearly 5,600 staff members are now fully vaccinated, representing 96% and 83%, respectively, of those eligible for vaccination. Additionally, all of our 26 communities have achieved our targets for resident herd immunity, and nearly all of our communities have reached both resident and employee herd immunity. We are so grateful by this level of participation amongst our staff and thank all who have participated in vaccinations. As we shared in recent episodes, many long-term care providers, including ACTS, have announced vaccine mandates. Our decision to mandate vaccination as a condition of employment was made for the safety and well-being of all those who live in, work at, and visit our campuses, and has been strongly supported by both residents and employees, as well as prospective residents and family members. As a reminder, all employees working in Oak Ridge Terrace or Willowbrook Court or provide direct care to residents must be vaccinated against COVID-19 by October 1, 2021. All other employees must be vaccinated against COVID-19 by November 1, 2021, unless approved for a religious or medical exemption. We also continue to encourage any residents that have not been vaccinated to reconsider and schedule a vaccination appointment as soon as possible. Speaking of vaccinations, this episode will focus on the latest information on booster vaccines and our preparations to administer them. As such, joining me in this episode will be Holly Schade, ACTS's Senior Vice President of Health and Home Services, and Dr. Paul Reinbold, Vice President and Chief Medical Director, who will provide an update on the latest developments and indications for the COVID-19 vaccine booster shots, as well as the status of virus variants and recent advances in medical therapies for COVID-19. So please join me in welcoming Holly and Dr. Paul.
Thank you, Karen. The U.S. Food and Drug Administration's Advisory Committee met on Friday, September the 17th, to review Pfizer's application for a third dose booster vaccine. As for the other two companies seeking booster approvals in the United States, Moderna has recently submitted their data for their booster approval, but it has not yet been reviewed by the FDA. And Johnson & Johnson has not yet submitted any application. The FDA did recommend Pfizer's COVID third dose booster 6 months from receiving the second dose for people 65 and older, and those at a high risk of suffering from illness if they get the virus, after rejecting the third booster vaccines for the general population. This decision was based largely on 3 studies published last week by the CDC that found that the present ability of these vaccines to prevent hospitalizations and severe disease remains essentially unchanged at about 97%, even after the Delta variant's arrival, except in adults over 75. Therefore, even though vaccines are very safe, it was not felt those outside of the recommended groups would derive significant additional benefit at this time. Please rest assured that at ACTS, we will be well prepared to administer the Pfizer booster shots recommendations. We have been actively working with our pharmacy partner CVS in pre-planning clinic dates. We have compiled a company-wide list of both residents and employees that are 65 years and above for the pending CVS booster vaccine clinics for both independent living and Oak Ridge Terrace residents and all employees. CVS will be administering the vaccines at these clinics, just like at our previous clinics conducted earlier this year. CVS anticipates that these clinics will begin at certain communities on an initial start date of October the 5th. The establishment of the actual dates for the third booster clinics will be based on the dates of the previous second dose clinic dates and will be shared with you as they are confirmed for your community. For Willowbrook Court residents, we have created the same list for those residents 65 and older. We have also submitted the preliminary Pfizer booster vaccine orders for Willowbrook Court to CVS Omnicare. And we are actively working on getting the necessary Willowbrook Court resident consent forms completed, as the community's clinical team will be administering the Pfizer booster vaccines to Willowbrook Court residents. Please remember that no vaccinated person would be at risk of a breakthrough infection if the coronavirus wasn't still circulating. That's why the push to get more Americans fully vaccinated is still the highest priority, and our highest priority here at ACTS. We all need to do our part in eradicating this virus once and for all. So do not hesitate. Please get vaccinated, and please get your third booster when it's made available. Thank you, and now please welcome Dr. Paul.
Thank you, Holly. Today, I would like to cover 4 topics. First, I will discuss the role and indication for the recently approved Pfizer COVID vaccine booster dose. I will then provide an update of current vaccine developments, explore the status of virus variants, and then review recent advances in medical therapies for COVID-19. On Wednesday, September 22nd, the U.S. Food and Drug Administration amended the emergency use authorization for the Pfizer COVID-19 vaccine to allow for use of a single booster dose to be administered at least 6 months after the completion of the primary series. The final guidelines just affirmed by the CDC authorize a booster dose for individuals 65 years of age and older, individuals that reside in a continuing care retirement community or congregate care setting, individuals 18 through 64 years of age with underlying medical conditions that put them at high risk of severe COVID-19, and individuals 18 through 64 years of age whose frequent institutional or occupational exposure to COVID-19 puts them at high risk of serious complications of COVID-19, including severe COVID. This decision was based on evidence from ongoing clinical trials, as well as real-world data from Israel's use of booster shots in 1 million individuals aged 60 and older from July 30th to August 22nd just this year, suggesting this additional dose restores the effectiveness of the vaccine to 95% in preventing COVID, essentially the same level initially seen after full vaccination. Except for a slight but transient increase in swollen lymph nodes, side effects and adverse events from boosters were no different than those seen after prior vaccinations. These boosters can be given no sooner than 6 months from the last prior vaccine dose, and at this time, these guidelines only apply to those previously vaccinated with the Pfizer vaccine. An authorization regarding a Moderna booster is expected in the next few weeks. There is still currently not enough data to determine whether an additional shot is needed after the one-time dose Johnson & Johnson vaccine, although data released by J&J on September 21st suggested a second shot 2 to 6 months after the first increased efficacy to 94%. The FDA and CDC are actively working to provide guidance on this issue. As Holly noted, ACTS will start scheduling clinics to deliver boosters based on these confirmed indications and will continue to communicate information as it becomes available. Rest assured, we will be able to administer a booster dose to everyone that should have one. For my next topic, I would like to provide an update on the status of available vaccines and review their current indications, in addition to those just discussed. We continue to have 3 very effective and safe vaccines manufactured by Moderna, Johnson & Johnson, and Pfizer. Pfizer's vaccine now has a full use authorization from the FDA for those 16 years of age and older. Full approval means the Pfizer vaccine now carries the FDA's strongest endorsement of safety and effectiveness. Johnson & Johnson and Moderna continue to be administered under an emergency use authorization for those 18 years or older, with applications for full use in process. These options provide good coverage for our adult population, with all vaccines in abundant supply. Children, however, remain a largely unvaccinated group due to the additional studies necessary to obtain vaccine approval. For those 12 to 15 years of age, there is an emergency use authorization for the Pfizer shot with the same 2-dose initial regimen given to adults. Moderna has an application submitted to allow those from 12 to 17 years of age to receive its vaccine. Both Moderna and Pfizer have submitted data for shots in those younger than 12, and it is expected a decision for those 5 to 11 years old will be forthcoming later in October, with a possible authorization for shots in those 6 months to 5 years by the end of the year, according to Pfizer executives. Pfizer also released data on September 20th confirming vaccine efficacy in their trials for those aged 5 to 11. The ability to finally vaccinate this large at-risk group, continued adult vaccination efforts, including boosters and third doses, combined with existing immunity, should dramatically reduce active disease and transmission by the end of this year, if not sooner. Vaccines play a critical role in reducing the severity and number of infections, thereby reducing the potential for mutations that lead to variant viruses. the next topic I would like to touch upon. Mu and Lambda are the most recent variants making the news. Categorized by the World Health Organization as variants of interest, these viruses have genetic mutations that might lead to increased transmission or virulence, with some existing transmission currently recognized. Variants in this category are monitored but considered to be the least risky. The next, more concerning level of distinction recognizes variants of concern. These include Delta, Alpha, Beta, and Gamma. These are viruses that have demonstrated increased transmissibility, virulence, and spread despite mitigation efforts. The most concerning classification, variants of high consequence, include those viruses that have significant resistance to existing vaccines or therapeutics, combined with significantly increased infection severity and transmission. There are no variants currently in this category. Due to genetic mutations, by definition, variants are structurally different from the prior original virus. The most important question is whether these structural differences in turn lead to more transmissibility, more severe disease, or drug and vaccine ineffectiveness. At this time, Mu and Lambda do not appear to have increased transmissibility nor pathogenicity, and a resistance to vaccines is only theoretical. The Delta variant continues to be our main concern, and because of this strain's transmissibility and enhanced ability to replicate, it is outcompeting other variants and keeping them in check. Thankfully, the efficacy of our available vaccines in preventing severe disease and hospitalization has been maintained against this and other circulating variants based on the information currently available. To end on a positive note, I wanted to share the progress that continues to be made with therapeutics. For those with mild to moderate COVID-19, available monoclonal antibody infusions continue to work very well in mitigating progression to more severe disease in most cases, with very little in the way of side effects. Additionally, in early August, the REGEN-COV monoclonal antibody combination was approved as a preventative infusion or subcutaneous injection for immunocompromised or unvaccinated individuals with significant exposure to COVID-19. Again, showing good efficacy and little in the way of side effects. There is also promising news regarding oral therapies. Molnupiravir from Merck continues in its clinical trial for outpatient treatment of mild to moderate COVID, with possible availability before the end of this year. Recently, Merck began another phase 3 clinical trial with this agent for prophylaxis of COVID-19 in those with exposure. Pfizer, around that same time, announced the beginning of a phase 3 trial for its antiviral oral pill for treating mild to moderate outpatient infection. There are many other promising therapeutics in development for both inpatients and outpatients. This is all very hope-inspiring because therapeutics, when combined with the impact of vaccinations, will allow effective management of COVID-19 through both prevention and treatment, finally bringing an end to this pandemic. Thank you.
Thank you, Holly and Dr. Paul. And thank you for watching this episode of AxVision, Our Journey Forward. Throughout the pandemic, we have endeavored to keep our communities safe as well as active and engaging. Please know that we remain committed to doing everything possible to return to life before the pandemic while preventing COVID cases and exposures. It has been through our collective actions that we have come so far since March of 2020. We thank you for your ongoing vigilance, patience, and support. And may God continue to bless you, your families, and the entire AX organization.